Welcome back. A new clinic is bringing specialized ALS cares closer to home for patients in Northwest Ohio. This afternoon, we have Dr. Clayton Buback here with us so we can learn more about it. Welcome. I'm eager to talk to you about ALS. I had a dear friend 25 years ago or 30 years ago. We're playing tennis on a Saturday morning, and he was very clumsy at the net. He kept tripping over his own feet and would go down, and then was complaining about he just had felt clumsy lately. The next thing we know, he's done playing. He was diagnosed with ALS, and he went rapidly. And I know at the time there was no treatment for it. Have we not gone anywhere at all in the last 25, 30, 40 years in treating ALS and at least curing it?
Yeah, well, let me say thank you for having me, and I'm sorry to hear that story. It's a story that I have heard many times.
All the time you hear that.
I think people don't appreciate how common ALS actually is. It's a disease where oftentimes people do not have a long lifespan after diagnosis, and so there are not necessarily a lot of people with ALS walking around at any given time. But when you look at the number of people diagnosed, I think people are very surprised to see how high that number is. You know, within a 50-mile radius of Toledo, the ALS Association estimates there are 750 people with ALS at any given time. So it's a much more common disease than people think.
So Lou Gehrig's is what it goes through. Stephen Hawking is someone, a very famous scientist who had ALS and lived for quite a few years. And it is possible to live for a few years, but it most likely is not. Tell me about the clinic, the clinic that's been going on since what, last year it opened up, and you're head of the clinic?
That's right.
Tell me about where it is and what all you offer there.
Yeah, so the clinic is at the Neurosciences Center, which is a partnership between the University of Toledo and ProMedica. And to answer your question from before about treatments for ALS, there are some medications that can be helpful, but the most impactful change that we've made in ALS care over the past 2 decades has been in supporting patients in their respiratory status and also in their physical status. People falling down can be a huge issue. And so imagine you've just been diagnosed with a progressive fatal neurodegenerative illness that's going to affect muscles all over your body. So it's going to affect your arms and your legs. It'll affect the muscles that control speech and swallowing. So all that means is you're going to need to see a physical therapist, occupational therapist, speech language pathologist, respiratory therapist, pulmonologist, dietitian, neurologist. And this is a disease where your mobility will decline over time. And so how are you going to go to all of these different appointments over and over? The idea behind the clinic is patients come and they spend a half day in our clinic in the same room, and all of these different healthcare providers cycle through. The benefit to the patient is the consolidation of care, as well as seeing a team that has experience in ALS. And the benefit for us is we as providers get to look each other in the eye and talk face to face about our patients. I learn every day from our physical therapists and our occupational therapists and our pulmonologists, and it just is a much better way of delivering care.
Since it's centralized now, where would they have gone before? Cleveland, how has it been in the past?
Those are the 2 primary places, so that adds a lot of round-trip driving for patients. There are also patients in our area that I know who have chosen not to establish with those clinics, and so we have some patients who were diagnosed some time ago and did not link into care at all because care was too far away, who are now in our clinic, and we're playing catch-up trying to get them established with all the care that they need.
Have they been able to establish any connection at all? Is it exposure to some kind of something happened that was catastrophic that speeds ALS along? Or have they even been able to find a cause at all?
It's $1 million question. There's a lot of different things that have been found to increase your risk of ALS slightly, but none of them have been slam dunk. None of them are a tight enough association to really give us the explanation that makes sense at a cellular level as to why people are getting this disease. One of the ironies of ALS is oftentimes the people who get it are very, very healthy people. You know, being a triathlon or just an ultra marathoner increases your risk. Being a veteran increases your risk. And we don't understand why some people get this disease.
Yeah, I just hope that they can get some research going. It's just funny that nothing's ever been going on, and we've known about, Lou Gehrig is probably the first famous person ever got any kind of notoriety for it and getting the attention, but nothing's really they've been unable to cure it.
There's so much research going on. I think every day we wake up hoping that today is going to be the day that we hear about a breakthrough. There are some forms of ALS that are genetic. They make up a small number. Most people with ALS do not have a genetic form, but there is a gene therapy for one specific genetic form. That's a very small number of patients that are eligible, but at our clinic, we provide genetic testing for all patients for that reason.
The clinic number right there is on your screen, 419-291-3900. So if you or your family knows someone that needs that kind of treatment, by all means, give them a call. The doctors are there at one-stop shopping for the patients. Doctor, thank you so much for being here.
Thank you.